Magandang hapon po muli sa ating mga tagapanood, tagapakinig. Magpapatuloy po tayo sa ating mga pagre-review, pag-aaral. Ang topic po natin ngayon ay ang types of Qi. So, the 5 vital substances. Ito po yung mga substance na nasa ating katawan. Ito yung Qi, Jing, Sui, Shen, and Jinye. So yung Jing po ay yung Jing essence. Yung mga manang energy. Sui or blood. Shen po yung spirit. Spirit mind. Tapos yung Qi po, ito yung vitality. Yung Jinye po, ito yung fluid sa ating katawan. So yung Qi po or Qi, ito po yung life force. So most basic of the fundamental substances. Lahat pong substance sa katawan natin ay may Qi. Ang Qi po ay nagpo-flow po through Jing law, yung mga meridian. Doon po dumadaan yung Qi. So corresponding to particular points on the body. So lahat pong substance sa katawan natin ay merong Qi. So energy is all permitting and control every living being, inanimate object, or phenomenon. So energy is necessary for change, for sensory function, for reproduction, for birth, growth, and death cycle. So lahat ng aspeto ng buhay natin, ng katawan natin ay may energy or Qi. Qi, blood, body fluids are fundamental substances that maintain normal vital activities of the body. Our total energy in our present life is called vital energy. When it used for function, it is stored by kidney in form of vital essence. So, yan po yung ating mas madali man natin maintindihan. So, ang congenital energy, also called yuan or ancestral energy. Ito po yung energy we are born with, inherit from our parents. Mga naman natin sa ating magulang. Halimbawa, yung height ko naman ako sa aking magulang ay matangkad. So, yun po yung mga energy na nakapaloob doon ng mga energy naman natin. Tapos, an acquired energy naman, this is the energy we acquired after birth through our life from our food, air, rest, and environment. So, yung pagkatapos na po natin ipanganak, kaya kailangan natin kumain ng maayos, dapat maayos yung ating environment para malusog yung Qi from air at yung ating lifestyle para yung acquired energy natin ay maganda. So, vital energy, the source of which, yan ang pinanggagalingan po ng vital energy, yan dalawang yan. Congenital energy and acquired energy. Congenital, mula doon sa ating naman ng enerhiya mulang pinanganak. Ang acquired naman ay mula sa ating mga pagkain, sa air, at sa ating mga lifestyle. Doon nanggagaling yung ating mga energy. Next po. So, two basic types of Qi. Ito yung free heaven or ancestral Qi. Parang inuulitin lang naman po yung explanation is the Qi that we are born with. It is limited and the quality and amount of this Qi represent our basic constitution. So yung ancestral Qi, yun nga po yung sinasabi ko, kung ang naman akong Qi ay matangkad, nagiging matangkad po ako. Pero kung maiksi din. Kung ang ilong ko ay pango, kasi yun yung Qi din na naman ako, yun doon na form yung aking katawan. Kaya iba-iba yung mukha natin kasi iba-iba ang naman natin na Qi. So, yung post-heaven Qi naman po, ito yung na-acquire natin. On the other hand, it is derived from food. O, kung healthy food yung kinakain natin, yung post-heaven Qi natin, i-healthy. So, mas malakas tayo. Tapos kung ang ating environment ay walang mga pollution, so yung earth Qi natin na nakukuha ay healthy din. So the quality of post-heaven Qi depends on our lifestyle, habits such as food, quality, balance of emotion, physical exercise, and so on. Kaya napakahalaga po ng post-heaven Qi natin. Ito yung kung paano tayo kumakain, ano yung mga pagkain natin. Pag mga junk foods, pag mga lahat ay hindi healthy food, so yung post-heaven Qi natin, hindi rin healthy. Yun, doon tayo nagkakaroon ng karamdaman. Kung ang emosyon natin, hindi tayo marunong mag-control, lagi tayong galit, yun, magkakaroon na yung post-heaven Qi natin. Hindi tayo nag-exercise, yung mga ganun po, yun yung mga nagiging dahilan kung bakit humihina ang Qi. Just as one cannot choose their parents, siyempre hindi tayo pwedeng mamili ng ating mga magulang. One cannot choose their congenital energy. Halimbawa, kung nanaisin ko man maging matangkad, kung talagang yung magulang ko maliit, hindi ko sila pwedeng palitan. On their energy at birth. But their acquired energy can be influenced after birth. Pero yung mga acquired energy natin, pwede nating ayusin. Halimbawa, kung talagang hindi ka pangit ang skin mo, dry, kasi yung na-acquired mong Qi ay mahina. Kung kakain ka ng maayos, pwedeng maayos yung skin mo, pwede maging healthy. Kasi manggagaling sa post energy natin. Asan ako? And because of that, vital energy can be increased somewhat. Yung vital energy natin, maaari ding tumaas. This vital energy seems to increase and decrease with our reproductive energy during our lifetime. So yun po yung na-explain na, A woman's life is made of 7-year cycles, and the peak of her vital energy coincide with her reproductive energy. So itong diagram po pinapakita after 49, a woman enters the menopause, yung mga nagme-menopause na, and her vital energy is just sufficient for her to carry on her rest of her living function. So pa-decline siya, so katamtaman na lang sa kanyang mga para mamuhay siya ng maayos, makagalaw pa siya ng maayos, pero pa-decline na po siya. A man's life is made of 8-year cycles. This graph shows the best age for a man and woman to have children from a child vital energy point of view. Ayan, pakikita natin yung pinakang mataas, yung peak. Tingnan po natin sa next slide kasi may different yung female at saka male. This vital energy is a functional energy and needs constant fuel or nutrition. This fuel or the stored form of vital energy is called vital essence. One could say the vital energy is like an engine of car in motion. The more powerful the engine, the faster and the better car moves. Vital essence is like the petrol needed to keep in car in motion. Even the best of engine need fuel. Without fuel, they will come to a standstill sooner rather than later. So, pag ang maikling lang po niyan, ang vital energy, ito yung functional energy natin. So, kailangan natin kumain ng maayos, yung lifestyle natin, yung mga exercises natin, kailangan maayos para yung vital essence natin na siyang pinanggagaas natin sa vital energy ay maging maayos din. Parang yun po yung shortcut niya. So, the vital energy and vital essence is what we call yin and yang. So, yun yin and yang natin. It is in every organ and every cell of the body. But the kidney store the vital essence and make the vital energy for the whole body. Therefore, low energy or tiredness is basically a problem of the kidney deficiency. So, kasi nga, ang vital essence ay naka-stored sa ating kidney yin. Yan yung gaas ng ng vital energy. Ang vital energy naman or yung Qi made by kidney yang. So ginagawa yan ng kidney yang. Ay, hanggang doon lang pala. Okay po, may tanong po tayo o may addition po, Doc?
Mukhang wala na for now. Maraming salamat, Mildred, and I'm sure napaka-kumpleto na po noon, and everybody's happy. Or somebody would like to add?
Opo, yung kung hindi pa po natin naunawaan, pwede tayong magtalakayan. Kasi habang nagtatanungan tayo, mas naintindihan.
Yeah.
Pero kung wala nang tanong, ibig sabihin naintindihan.
Okay. Maraming salamat, Ma'am Mildred. We will now
Thank you
proceed
po.
to tongue diagnosis. Let's welcome from Rizal, si Ma'am Teresita Sumile. Good afternoon, Ma'am Teresita.
Good afternoon po, Dr. Hector and classmates. Welcome po sa tongue diagnosis. Chronic cough, case number 6 na po tayo. After having severe pneumonia as a child, Mrs. B suffered from a mild form of bronchiectasis. The 50-year-old patient had a chronic cough with copious green-yellow sputum and reported that she always felt its presence in her lungs. She had a tendency to catch colds during autumn and winter. 1 year ago, a benign tumor of the parotid gland was diagnosed, which at the time of treatment measured 3 cm by 1 cm. The tumor was of a firm rubbery consistency, although it caused no pain. In general, the patient felt well, had deep red. Her menopause had passed without incident. The tongue body was pale and had deep red points, plus a depression in its anterior third. The center and posterior third of the tongue had a dark yellow coating. Her pulse was confined and slippery. So this is the tongue picture of the patient, which has depression on the anterior third. The tongue color is pale and has red points. And the posterior third has yellow coating. Okay? So analysis. As a result of the chronic cough, lung qi had lost its root, which led to lung qi deficiency. This was reflected in the depression in the anterior third of the tongue, which suggested deficiency of the gathering qi and lung qi. This weakness also contributed to her tendency to catch colds. Now, Mrs. B also suffered from long-standing clumping of phlegm heat in the lungs that was responsible for the expectoration of green-yellow sputum. The heat was reflected in a deep red points on the tongue. The chronic phlegm heat in the lungs interfered with the downward directed action of the lung qi and gave rise to the chronic cough. Okay? Now, before treatment with Chinese medicine began, Mrs. B ate a vegetarian diet with a lot of raw foods and dairy products. This weakened the skin qi and was responsible for the formation of internal dampness. Her protective qi was weak, as evidenced by the frequent invasion of wind cold in autumn and winter. The pathogenic factors constrained the lung qi, which quickly transformed into heat. Because of the underlying accumulation of dampness and phlegm heat in the lungs readily formed and continuously fed the persisting pathology. Okay? The coating on the anterior third of the tongue, which corresponds to the lung area, was thin and showed a depression. Thus, as stated above, the tongue only showed the deficiency of lung qi. The presence of phlegm in the lungs, however, was not visible on the tongue. The yellow coating, indicating the presence of accumulated damp heat, was located at the center of the posterior third of the tongue. This confirmed the underlying involvement of the spleen qi producing dampness, especially as the center of the tongue body was also slightly swollen. The yellow color was indicative of transformation in dampness and phlegm into phlegm heat. A similar pathology was responsible for the formation of the tumor in the parotid gland. The inability of spleen qi to transport and transform dampness led to an accumulation of phlegm, which interfered with the flow of qi. The phlegm in this case coalesced into a knot, which is to say, a tumor. The rubbery and firm consistency of the tumor, as well as the firm slippery pulse, corroborated this finding. Okay? Now let's go to treatment. The aim of treatment was to clear the heat from the lungs, transform phlegm, regulate the lung qi, and soften and dissipate the tumor. The patient was advised to abstain from raw foods and dairy products so that the spleen will not be more weakened, and to eliminate damp, and to avoid additional dampness. Okay? Over a period of 4 months, the patient was prescribed a modified combination of filaria and trichosanthus fruit powder and sargassum decoction for the jade class. Classmates, kindly pakibasa na lang po sa mga ingredients by yourself because sad to say, I could not clearly pronounce this. Pasensya na po. Now, following this treatment, and for the first time in her life, Mrs. B did not catch cold in autumn or winter. The cough was noticeably lessened and the expectoration reduced. The sputum was now a pale yellow color instead of green-yellow color. The tongue shape and color had likewise improved, as we can see in the tongue picture above. Okay? The depression in the anterior third of the tongue was no longer visible, and the coating was normal. Okay? Now, the latest examination by ultrasound showed that the tumor had decreased in size by 1 cm and felt softer. As Mrs. B tolerated the herb so well, the treatment was continued for a few more months. Okay? Yan lang po. Thank you so much for listening.
Thank you very much, Ma'am Teresita. Anybody would like to make a comment? Okay, kung wala na po, we will proceed to diagnosis by interrogation. Okay, so we will continue with the topic on the feeling of cold. Okay, nag-umpisa tayo yesterday, and so now we will talk about the terminology. Okay, the cause of disease in the feeling of cold, feeling of heat or fever, pwede pong external. For example, external wind, or internal. So the cause of disease, pag sinabing cause of disease, it simply refers to the origin of the pathogenic factor. So the pattern or syndrome refers to the location of the pathogenic factor. So napaka-importante po na ma-identify natin ang pattern because it will tell us the location of the pathogenic factor. Pwedeng interior, pwedeng exterior. This is decided not according to the origin of the pathogenic factor, but on the basis of the clinical manifestations. So an external cause of disease, example, external wind, pwede pong mag-cause both exterior pattern and an interior pattern. So here you could see the relationship between external and internal causes of disease with exterior and interior patterns. So pwede mong makita na An external cause of disease can cause both exterior and interior patterns, while an internal cause of disease obviously will cause an interior pattern. An external cause of disease is, for example, external wind, will initially cause an exterior pattern. So pag hindi po na-expel yung pathogenic factor, hindi po nag-acupuncture, it will continue to penetrate the interior. So it will now cause an interior pattern. Okay? So an internal cause of disease, example, liver fire. Kaya bawal tayo magka-liver fun. It causes an interior pattern by definition. So with regard to fever, we should not confuse a fever from an external cause with an exterior fever. An external cause, pwede po siya mag-cause ng exterior fever initially, and later, pag hindi na-expel yung pathogenic factor, it will cause an interior fever. So feeling of cold, meron po tayong 4 degrees of cold feeling. So which can apply to both interior and exterior conditions. So in ascending order of severity, these are aversion to wind. So this is literally loathing or disliking wind, ayaw ng wind. Followed by fear of cold, aversion to cold, loathing or disliking cold, shivers. So yung symptoms of feeling cold should be clearly differentiated between interior and exterior patterns. Aversion to wind means nagkakaroon po ng goose pimples ang pasyente. Dislikes going out in the wind, gusto niya indoors lang. Fear of cold, the patient feels quite cold, gusto niya sa indoors lang, close to a source of heat. So meron siyang heater and wants to cover up. Aversion to cold, the patient feels very cold, wants to stay indoors, and likes to wrap up in bed with many blankets. Shivers means the patient feels extremely cold, shivers, and wants to be covered up in bed under a heap of blankets. So the discussion of feeling of cold will be articulated in 3 parts. Feeling of cold in interior conditions, feeling of cold in exterior conditions, and how to distinguish between external and internal causes of feeling of cold. And this will be discussed on Thursday. Thank you very much. Unless you have any questions. Okay. So if you have no questions, we will now proceed to pulse diagnosis. Let's welcome Sir Dino Pinero straight from Legazpi. Good afternoon, Sir Dino.
Good afternoon, Doc. Good afternoon, classmates. Topic natin today is SAD pulse. The SAD pulse does not flow smoothly and lacks a wave. It is also short and rather weak. It is found either in all position or in an individual position only in the front or middle. Kung SAD daw na individual position, ma-feel lang po ito sa front and middle position. Ibig sabihin daw, the pulse can never have a SAD quality only on the rear position. Dun sa hindi siya pwedeng dun lang sa rear position. Pwede individual na ma-feel natin ang SAD position sa front and middle lang. So ito po yung figure ng front, middle, and rear. Sa normal, sa choppy, ito naman po yung figure. The clinical significance, the SAD pulse always indicates emotional problems, especially from sadness and grief. So dito natin makikita yung SAD pulse. It is a pulse that is frequently seen in bereaved patients. One can gauge roughly the duration of the emotional problem according to how many positions are affected. If the pulse is sad only on the front position, the problem is recent. So pag na-feel natin yung sad pulse sa front position, very recent po yung problem, about 6 months. If it is sad on the front and middle position naman, the problem is about a year duration. So tumagal na ng 1 taon. If it is sad all over sa lahat na position, it indicates the patient has been sad for a very long time. Possibly his or her whole life. So, pwede natin yan mapalpate dun sa mga patient na may emotional problem. If the person suffering from the above emotional problems has a good constitution, the pulse will display only the sad quality and no others. Pag healthy daw or in good constitution. If the person naman has a weak constitution, his or her emotional problems will eventually affect one or more organs. And this will be reflected in the relevant pulse position. Ang example dito, yung weak lung pulse, weak stomach pulse, wiry liver pulse. Sa SAD pulse, summary of clinical significance is merong emotional problems from sadness or grief. Sa combinations, meron tayong sad full, indicates emotional problems from grief affecting the lungs. Sa sad empty naman, indicates emotional problems from sadness affecting particularly the heart. Pag sad rapid, indicates emotional problems from grief and worry. Pag sad slow, indicates emotional problems from deep sadness affecting the heart. Sa sad choppy, denotes heart blood deficiency deriving from sadness. Pag sad fine naman, denotes heart blood deficiency deriving from sadness. Sa differentiation of similar pulses, the choppy pulse naman, like the sad pulse, lacks a wave, but it is also weak and empty by definition. The sad pulse is not necessarily weak or empty, and it is also short. Sa clinical significance in its position, sa front position, heart and or lung qi deficiency from recent sadness, about 2 years. So, dun yun sa may front position. Sa middle position, liver and heart blood deficiency from long-term sadness. The pulse cannot have the sad quality in the middle position only. Therefore, in this case, it will have this quality in the middle and front position. Sa rear position, a pulse does not usually have a sad quality in the rear position. So, thank you for listening.
Thank you very much, Sir Dino. Do we have any questions? Masyado namang sad. Okay, we will now proceed to differential diagnosis. And let's welcome Ma'am Needs You for large intestine deficiency cold. Good afternoon, Ma'am Needs.
Good afternoon, Doc Hector. Good afternoon, everyone. How's my audio, Doc?
Very clear po.
Okay, thank you po. Okay. Ang topic natin ngayon sa ating TCM Foundations 176 is large intestine deficiency cold. Okay. So, from the 5 elements, yung lungs at saka yung large intestines are partner organs. But if we think about the relationship, it doesn't make sense. Kasi yung large intestine and lungs are not anatomically connected. Pero sila ay mayroong relasyon, energetic relationship. Okay? So energetically, lung is responsible for distributing qi and the essence received from food throughout the body. Once the stomach and spleen complete the digestive process, spleen sends this nutritive essence to the lungs. The lungs then decides how much qi each organ receives and distributes it accordingly. Sa every inhalation, lung communicates with the outside world. The process of releasing from inside out is the duty of the large intestine. This duo must cooperate to allow the body to release and receive. Okay? So the quality of your lung qi can be seen in the regions of your skin as well as your elimination system. Dry, itchy, and cracked skin, wrinkles, kunwari, especially around the outside of the eyes, and constipation are signs that the lung and large intestine are not in sync. Hindi sila magka-join, kumbaga. While chronic constipation naman ay sign of unhealthy metabolism function, it also reflects an inability to release and go with the flow in many aspects of life, including emotions. Okay? Often, a problem that manifests itself in the lung will also express itself through the large intestine or colon or colon. In TCM, large intestine connects with the small intestine through the ileocecal bulb and its end part of the anus. And its end part is the anus, as we all know. Large intestine and lungs are connected and communicated, okay, with each other through their meridians. And this relationship makes them influential to one another physiologically and pathology. Para magkaiba yata. Ayun, example, kapag yung lungs ay inattack ng evils, na-impair yung disseminating and descending actions. Yung body fluids will have difficulty in distributing the intestines, and thus the result is hard stools forming in the large intestine. So yun yung epekto niya. In case naman, kapag yung lung qi ay deficient, large intestine will be manghihina rin, leading to constipation due to qi deficiency. Okay? On the other hand, excess heat accumulated in large intestine, it disturbs transmission process and it can in turn affect the lung functions, resulting in chest stuffiness and coughing. Okay? Yung large intestine, nire-receive niya yung digested food na natira from the small intestine and continue to absorb water from this.
Madam, nawala yung audio niyo.
Rumbling and diarrhea or constipation. Okay? Besides sa action ng large intestine, food residue transmission in large intestine also relies on proper lubrication by body fluids. Kailangan meron ding, kumbaga langis, yun yung body fluids, as well as the coordination of stomach, lung, and kidney. If any of these factors are abnormal, functions of large intestine will be affected. Yun, alam na natin, kapag nagkaroon ng yung katawan ng accumulated excess heat, ibig sabihin na dry up yung intestinal fluid at nagkakaroon ng constipation. So magkakasama sila, okay? So let's go here na sa summary. Large intestine deficiency cold. Ang etiology, excessive consumption of cold and raw foods. Prolonged exposure of the abdomen to cold weather. Mga nakalitaw parati yung tiyan dyan. Probable underlying spleen and kidney yang deficiency, okay? Possible presenting condition, chronic enteritis, chronic dysentery, okay? Parang pagtatae yata yan eh. Sign and symptoms, loose stools, loose stools resembling duck droppings. Para yung ipot ng mga ducks. Dull abdominal pain, pale urination, cold limbs, borborygmi, lower back ache, poor appetite, aversion to cold. Okay? Ito yung comparison. Spleen, stomach, and deficiency, ang stools may contain undigested food. There is poor appetite, oppression in the abdomen after eating. Okay? Kapag large intestinal yang deficiency naman, the disease is in the lower rather than the middle burner. It is accompanied by diarrhea and borborygmi. And may have constipation rather than diarrhea. Tandaan po natin. So, ang pulse kapag pinalpit nyo ay deep and weak. Kapag tiningnan naman nyo yung tongue, pale, thin, tongue, fur. Tongue coating yan manipis lang. Treatment principle, stop diarrhea and supplement Qi and Yang. Acupuncture treatment, stomach 25, stops diarrhea and pain. Stomach 36, supplements the spleen Qi. Bladder 20, supplements spleen Qi also. Ren 12, fortifies the spleen. Ren 6, supplements Qi and stops chronic diarrhea. Stomach 37, stops chronic diarrhea. Liver 13, transforms stasis. And bladder 25, supplements the large intestine. So, ang needle technique ay supplementation or tonifying, and we'll use moxa. Okay? Thank you very much, everyone, Doc.
Thank you very much, Ma'am Needs. Do we have any questions? Huwag tahimik ngayon. Okay, we will now proceed to the next topic, acupuncture patterns and practice. And Sir Dino will continue his discussion of cough kahapon. Good afternoon ulit, Sir Dino.
Good afternoon, Doc. Good afternoon, classmates. Okay, continuation po natin ang discussion kahapon about cough. Sa wind cold and wind heat. Cold and heat have a very different nature and require very different treatment. It is therefore important first to determine whether the illness is one of wind cold or of wind heat. So dapat natin alam, kasi magkaiba ang treatment. In general, injury by wind cold is characterized by stronger cold aversion than fever. So mas malakas ang aversion to cold than fever. Meron siyang headache and body aches and nasal mucosal congestion with clear discharge. Injury by wind heat is characterized by fever naman stronger than cold aversion. Dito, pag sinabing wind heat, mas malakas yung fever than the cold aversion. Meron din siyang headache, merong thirst, nasal mucosal congestion with thick throat. So yun po yung ano niya sa heat. Among these symptoms, whether the throat is sore and swollen or not is often the key to differentiating wind heat from wind cold. Sometimes in the initial stages, an illness may be one of injury by wind cold, but a few days later, sore throat may develop and the nasal discharge changes from clear to yellow and thick. So pwedeng mag-change from clear to yellow. This reflects gelling of the cold evil and its transformation into heat. So nag-change na from cold to heat. At this stage, the treatment is that of wind heat na po. So from wind cold, wind heat na po ang management sa pag-change ng symptoms. Second is accompanying pathogenic evil. In attacking the body wind is frequently accompanied by one or more of the other exogenous pathogenic evils. Dampness often accompanies wind during the rainy season of late spring and early summer, plum rain season. Wind dampness injury is characterized by low-grade fever, meron siyang headache as though being squeezed, bone and joint pains, chest tightness, and a bland or sweet taste in the mouth. So may sweet taste in the mouth. Heat accompanies wind, mostly during summer naman. Wind heat injury is characterized by fever with sweating, agitation, thirst, decreased and dark urine, and a yellow and greasy tongue coating. Dryness accompanies wind, mostly during autumn. dryness, wind injury is characterized by fever, headache, a dry nose and throat, cough with no or slight sputum, meron siyang thirst, and a red tongue. Indigestion from dietary excesses occurs mostly following festival or celebrations. Indigestion with wind injury is characterized by a feverish body, chest and epigastric distension, anorexia with nausea, diarrhea, and a greasy tongue coating. In clinical practice, it is important to determine what pathogenic evils have accompanied wind. So, kailangan natin alamin kung ano yung sumabay dun sa wind. Building on the foundation of releasing the exterior and unblocking the lung, the physician applies treatment to dissipate dampness, expel heat, moisten dryness, and remove stagnation. Only by doing so can the physician obtain excellent response. So, i-address po natin. Sa strength and deficiency naman, wind injury is mostly an illness of strength of pathogenic evils, but not invariably so. In differential diagnosis, the physician must first determine whether the illness is due to strength in the exterior or underlying deficiency in the exterior. So, kailangan natin alamin. In general, the fever with sweating and wind aversion are symptoms of deficiency in the exterior. So, yung pagsisweat, tapos aversion sa wind. Whereas fever without sweating, cold aversion, and body aches are symptoms of strength in the exterior. In an illness of deficiency in the exterior, the appropriate treatment is to disperse wind to release the exterior, but not to overuse acrid release. In an illness of strength in the exterior, the appropriate treatment is to induce sweating to release the exterior. So, papawisin po yung patient to release the exterior. As fever subsides upon sweating, so bababa po ang fever. If a deficient body is attacked by an exogenous evil, there may be repeated episodes of illness. The proper approach to treatment must be principally to support the genuine in order to dispel the evils. Thus, in addition to applying a method of exterior release in accordance with the specific exogenous evil, the physician must always attend to the support of genuine Qi. Acupuncture treatment for the wind-cold injury, select principally the acupoints on the lung meridian of the hand tai yin, the large intestine meridian of the hand yang min, and the bladder meridian of the foot tai yang, such as Li Ke, yung lung 7, Fing Men, yung bladder 12, Fing Qi, GB20, and the Hegu, Li4. Use filiform needles with the reducing method. For patients with a weak constitution, use the mild reinforcing and reducing method. Moxibustion may be applied in addition. For wind heat injury, select acupoints on the small intestine meridian of the hand tai yang, the large intestine meridian of the hand yang min, and the sanjiao meridian of the hand xiao yang, such as Dashu, GB4, Kochi, Li11, Hegu, Li4, UG, Lang 10, and Wei Guan, Sanjiao 5. Use filiform needles by shallow insertion and the reducing method. Sa case study, the patient was a 29-year-old male. He became ill with abrupt onset the day before consultation. He had cold aversion, merong fever without sweat, my headache, joint pains, cough with itchy throat and white sputum, and a dry mouth, but no desire to drink. His tongue coating was white and smooth, and his pulse floating, tight, and rapid. Ang temperature was 37.9 and pulse rate 92 beats per minute. His white blood cell count was 7.2 with 79% neutrophils, 22% lymphocytes. X-ray and fluoroscopic studies of the chest were normal. Sa diagnosis, meron siyang wind-cold joint by dampness. All lodged in the exterior defensive level and causing impaired flow of lung qi. So, lahat na symptoms leading to wind cold with dampness. Sa therapeutic principle, acrid warm release of the exterior. So, thank you for listening.
Thank you very much, Sir Dino. Any questions? Okay, kung walang questions, tuloy-tuloy tayo sa signs and symptoms. Punta naman tayo straight from Camarines Norte. And let's call on Sir Alvin Palabay. He will talk about mouth sores. Good afternoon, Sir Alvin.
Yes, good afternoon everyone, classmates, Doc, Hector. Naririnig po ba ako?
Clear po, clear, very clear.
Clear, okay. So, signs and symptoms. We're going to talk about mouth ulcers. Okay. So, mouth ulcers, a full condition kapag ang diagnosis natin or ang pattern is stomach heat. Usually, ang symptoms, ulcers with a red rim on the gums or inside cheeks. Mayroon siyang bleeding gums, thirst, foul breath. Kasi nga, stomach heat, di ba? Burning, epigastric pain, sour regurgitation, nausea, excessive hunger, a feeling of heat, red tongue with yellow coating, and overflowing rapid ang pulse. So, of course, ang mga acupuncture, so, mga acupuncture points, stomach 44, knitting, large intestine 4, of course, to release the heat, and LI 11, right? So, pagka ang pattern naman is heart fire, meron siyang tongue ulcers, thirst, bitter taste, palpitations, mental restlessness, kasi heart fire, feeling agitated, insomnia, dream, disturbed sleep, feeling of heat, may red face, red ang tongue with redder tip and yellow coating. So, ang pulse niya is overflowing rapid. Okay? So, ang acupuncture points niya, LI 11, okay? LI 4, saka heart 8. Okay? So, kapag ka empty condition naman, kanina full condition, ngayon naman empty condition, stomach and spleen Qi deficiency with yin fire. So, pale ulcers ang meron ng empty. Kapag ang pattern ng stomach and spleen Qi deficiency with yin fire. Okay? So, slightly red face or pale face with a floating red color on the cheeks. Meron siyang intermittent and recurrent feeling of heat in the face but cold ang limbs. Intermittent sore throat, dry mouth, dry lips, exhaustion, poor appetite, poor digestion, kasi nga involved ang stomach, weak din ang limbs, pale ang tongue, kasi nga deficiency, weak or overflowing, empty ang pulse. Okay, these ulcers are due to yin fire, as described by Li Dong Yuan in his discussion on stomach and spleen relationship. Okay, so ang acupuncture point to nourish the spleen, the Qi, Ren 4, Ren 6, Ren 12, Li4, release the fire, and spleen 9, Ying Guan. Right? So next slide please. Kapag empty naman siya, or full, at the same time full, yin deficiency with empty heat. Ulcers with a pale ring aggravated by overwork and lack of sleep. Okay, dry ang throat at night, feeling of heat in the evening, night sweating, 5-pound heat, malar flash, red ang tongue without floating, empty, floating empty, and rapid ang pulse. Other symptoms and signs depend on the organ involved. So ang acupuncture points, spleen 6, kidney 3, Ren 4, to nourish yin, and other points to clear empty heat depend on the organ involved. All right, so next slide please. Other patterns, liver fire, ulcer inside the cheeks, very painful and red in color, thirst, bitter taste, headache, commonly red face, dizziness, tinnitus, irritability, propensity to outbursts of anger, constipation, dark ang urine, ang tongue niya red with redder sides and dry yellow coating, and ang kanyang pulse is wiry, rapid, pag liver fire. Right, so next slide please. When our pattern natin is toxic heat, ulcers inside the cheeks that are red, festering and ooze, sticky yellow pus, fever, thirst, red tongue with red points, and thick sticky yellow ang coating, overflowing, slippery, rapid ang pulse. Alright, so kapag ka-invasion of wind, heat with phlegm naman ang pattern, oh my God. Ulcers inside the cheeks that are red and swollen and ooze, may ano na, thin yellow pus na. Aversion to cold, fever, may cough, may sore throat, stuck or runny nose with yellow discharge, headache, body aches, slight sweating, slight thirst, swollen tonsils, nausea, vomiting, a feeling of oppression of the chest, tongue slightly red on the sides, in the chest area, or on the front part. Floating rapid pulse ang ating makikita. Okay? So, kapag ang pattern naman, invasion of wind, cold, with kidney deficiency, of course, may ulcers inside the cheeks that are swollen and have a white rim. Aversion to cold, meron siyang fever, may cough, may itchy throat, slight breathlessness, stuffy or runny nose with clear watery discharge, with cold kasi sneezing, occipital headache, body aches, thin white tongue coating, lower back ache, and may dizziness siya, tinnitus, pale din ang kanyang tongue. Meron siyang thin white coating top of pale. Okay, ang kanyang pulse, floating and tight. Right, so clinical notes. Remember, for mouth ulcers on the gums and inside the cheeks in women, treat the directing vessels irrespective of the pattern causing them. If they are on the tongue, treat the heart channel, especially heart 5 or the zong. Thank you so much, everyone. Dr. Hector, thank you so much.
Thank you very
Any
much,
questions po?
Sir Alvin. Thank you po. Okay, till next time. So kung wala pong questions, we will proceed to the last but not the least topic, still on asthma. And let's welcome naman straight from Pangasinan, Sir Aldrin Tukay. Good afternoon, Sir Aldrin.
Hello po, Dr. Po. Good afternoon po. Medyo nagsisimula ang ulan dito sa amin. Hopefully, hindi mag-interrupt si Wi-Fi. So, proceed na po tayo. Good morning po good afternoon po sa lahat. Okay, so I think naririnig naman po siguro ako. Just interrupt me kung hindi na po ako naririnig. Okay, so okay, so nasa 9th day na po tayo sa asthma, identification of patterns and treatment na po tayo. So, yun, di malimit nating marinig nung nakaraan si Xiao at saka si Chuan, okay? At saka, yun nga, na-discuss natin yung mga gaps, bakit hindi yung asthma is hindi siya necessarily na Xiao at saka Chuan. Okay, so although yung mga ibang signs and symptoms nagmamanifest sa Xiao Chuan, so hindi ito ibig sabihin na 100% ito yung pathology niya. Okay? So in order to discuss the differences and connection between asthma and Xiao Chuan, so it is better to deal with Xiao and then Chuan separately. So ano ba yung pagkakaiba nitong dalawa? Parang, sorry. So pag sinabi nating Xiao, it will be remembered that the main pattern in Xiao are as follow. Okay, so may cold phlegm, merong hot phlegm. Okay, so wait lang po. Okay, so yon may cold phlegm at saka hot phlegm. And then, yon kailangan din natin malaman yung in-between attacks niya. Okay? So, merong lung deficiency, may spleen deficiency, at saka kidney deficiency. Okay? So, more on deficiency pattern. So, yung kailangan nating tandaan when we're talking about Xiao, okay, so the differentiation of treatment during or in between attacks is important and is used in the treatment of asthma. So, the distinction between cold phlegm at saka hot phlegm, paano natin madi-distinguish kung cold phlegm siya or hot phlegm? Useful siya in treatment of allergic asthma to differentiate between two basic types with cold or heat, even though there is no phlegm. Okay, so identify natin kung cold pa siya or heat. Kasi sometimes hindi necessarily na cold phlegm or heat phlegm. Kasi may mga instances na no phlegm pero merong traces ng either cold or heat. Sa Chuan naman, kailangan nating tandaan na either full or kay empty condition po yan. Pag full condition, may invasion of wind cold on exterior, phlegm fluids in interior. Cold on exterior, heat in interior. And then phlegm heat in lungs, turbid phlegm in lungs, lung qi obstruction. Kapag empty naman, so deficiency din. May lung deficiency at saka kidney deficiency. So, kailangan nating tandaan sa Chuan, yung external wind cold can trigger an acute attack of asthma. Okay? From a Western point of view too, it is well known that viral infections can trigger allergic asthma in sensitized individuals. Furthermore, activation of muscles causing bronchoconstriction may be elicited not only by allergens but also by exercise, cold air, and hyperventilation. So, yun nga, di ba, pag pinag-uusapan kasi natin sa Western point of view, kapag sinabi nating asthma, di ba, merong allergen. Tapos yung allergen na yon, yun yung nagkukos ng bronchoconstriction. Okay? Pero dito, hindi lang yon, hindi lang yung allergen. Kasi may mga instances kapag meron ka na talagang hika, kapag nag-exercise ka, yung parang nahapo ka, napapagod ka, ganoon. Kaya yun, magti-trigger din po yun ng bronchoconstriction. And then yun, kapag malamig yung weather, malamig yung hangin, ganyan na nagkukos din po yun ng constriction. An invasion of external wind that is not expelled properly or that is suppressed with antibiotics may also cause the beginning of asthma in non-atopic children. Okay? So meaning, kahit ibig sabihin pag sinabi nating asthma, so hindi ito yung early onset asthma. Okay? So pwedeng sa adult mag-manifest or magkaroon din ng asthma kahit na hindi from childhood. O lalo na kapag yung invasion ng external wind hindi na-expel, tapos nag-penetrate pa deeper, then na-suppress nga ng antibiotic, sabi dito. So exterior wind cold with interior phlegm fluid usually occur only in adult, as phlegm fluid is a chronic condition that develops only over many years. Okay, so meaning pag pinag-uusapan natin si phlegm fluid, ganyan parang nadidevelop to over time. Ganoon. So hindi siya magiging phlegm fluid agad-agad. Okay, lalo na kapag wrong treatment, napabayaan. Okay, yon kapag meron phlegm fluid, magma-manifest later on allergic, magkakaroon din po ng asthma. The pattern of cold on the exterior and heat in the interior corresponds not to asthma but to an acute chest infection. Okay. Then the pattern of phlegm heat in the lungs corresponds not to asthma but to acute bronchitis, pneumonia, and febrile episode of bronchiectasis or stasis. Stasis, okay? Then the pattern of turbid phlegm corresponds not to asthma but to a severe chest infection with sepsis. Okay, pag sinabi natin sepsis, infection, yung infection hanggang blood, andun na siya. So the pattern of lung qi obstructed corresponds to an acute attack of asthma in adult from emotional stress affecting the liver. It does not correspond to early onset asthma. Okay, so Q1 from lung deficiency correspond to chronic asthma, and then Q1 from kidney deficiency corresponds to asthma or emphysema in old people, not to early onset asthma. Okay, so yun, tandaan lang po natin yung mga pointers na yun. Although some of the signs and symptoms ng Chiao at saka Q1 related sa asthma pero not all. Okay? So, yun lamang po. Thank you po.
Maraming salamat, Sir Aldrin. Do we have any questions? Okay, wala pong questions. I hope you can join us tonight, 8 p.m. with Dr. Gavino. Meron po tayong discussion on the Jing River points. No? Wala po tayong Zoom tomorrow. We'll see you on Thursday po. Maraming salamat sa mga nag-attend and also especially sa mga presenters. Good evening, everyone. See you later po.
Thank you, Doc.
Thank you po. Good evening.
Good evening po sa lahat. And